like where's she
Okay. All right, we're presenting on overtraining syndrome. I'm Kendyl.
Jake.
Logan.
Unless you didn't know that already. So a little introduction. So physical activity and training have a really huge impact on the body in a good way if it's done correctly. Athletes continue to push their physical limits, so we always see the world records and stuff for Olympics, like they keep getting higher and higher, that kind of stuff. There are lots of benefits for becoming elite in athletics, obviously money, fame, whatever you consider as a benefit. And then training is beginning earlier and earlier in life. So kind of like Brian was saying, that like the sports specialization is starting earlier and earlier, so that causes people to train at higher intensities and for longer duration even earlier in life, so that can also have an effect on this as well.
So the definitions of overtraining, the NSCA describes it as excessive frequency or volume that it results in extreme fatigue, illness, or injury, often due to an insufficient amount of rest or recovery, and that's not to be confused with overreaching, which is just short-term excessive training. So you get the overtraining when it's easier to explain with like weight training. So you would have an increase in intensity or weight, and when you have the increase in intensity or weight, you would want to have a decrease in the amount of volume you're doing, so the amount of sets and reps, and it would be the opposite. So if you had a decrease in intensity, you would want to see an increase in volume. But if you don't do that, then you're gonna get this redip, and then you're overtrained. But if you do it on a short-term basis, you can actually get some positive benefits from that. So it's all about knowing where you're at as far as your intensity.
And then this video basically just explains that graph essentially.
Yeah, we're only going to play part of it, but...
Let's talk about overtraining. In the clinical and practical research, the definition of overtraining is quite convoluted. In fact, there is no literary consensus on the exact definition of overtraining. Neither is there for its underlying causes and symptoms, with some experts debating whether it even exists at all. But research data shows overtraining at least does exist, especially in the realm of competitive sports. Data shows anywhere between 7 to 31% of athletes experience overtraining on a yearly basis. It is important, though, to distinguish overtraining to overreaching. Unlike overtraining, overreaching is actually desired. At the beginning of a training program, you'll experience a consistent performance and training capacity improvement over time. Eventually, performance capacity stagnates and then decreases, aka you start to functionally overreach. This is desired because once you begin taking recovery measures for overreaching, which takes roughly 1 to 2 weeks to fully recover, your body not only reverses the performance drop, but you actually end up improving well beyond past previous capacities. This is known as supercompensation. When you do not rest and instead train through it, performance continues to wane. Around 4 weeks of training past degradation, a few weeks of recovery is no longer enough, and supercompensation ceases to exist. This is the point where the literature agrees on defining the phase of overtraining. Much of the literature also classifies overtraining as a syndrome. Underlying the causes and symptoms of overtraining are multifactorial in nature.
So that, I think that kind of that explains the graph really nicely. It's a good good little graphic to have it explain. So those are the kind of difference for overtraining and overreaching. So some signs and symptoms. These are pretty wide in variety. Like there's a ton of things that you could have, you couldn't have. But a lot of it was like the feeling of drain, lack of energy, like lack of motivation for your sport, that kind of thing. And then a lot of it was mood. Like a ton was more psychological, so you could have feelings of irritability, depression, that kind of stuff. And the also the slower than normal return of pulse rate after exercise. So if they're thinking about it as an elite athlete, usually their return to normal heart rate is pretty fast. So it could be longer than normal. A raised early morning and resting heart rate is also a sign of this. Insomnia, other sleep problems. It's honestly, this is kind of like a snowball effect. Like once you start to have one thing, like other things affect it. So the insomnia causes you to have less rest time, and so it kind of can exacerbate all the rest of these symptoms. Headaches, decreased immunity, so you might get more sick often, and then an increased incidence of injury as well.
So just some of the causes for overtraining. Mental stress is a big one. The stress of competition, is very heavy, especially in higher level athletes. And life can also sometimes be stressful, like end of the semester projects or exams, for example. Very stressful. Poor workout plan, that's a big one. If your program isn't periodized in the right way to kind of manage your fatigue and recovery, then you're gonna get that. You're not gonna be just overreaching. You're gonna get the overtraining, and lack of sleep. So that's a really big one. The sleep, training, and nutrition are all kind of I like to think of it like a pyramid or a triangle, and then they're each on one side, and you want to be in the middle. So if one side falls, then it kind of throws the whole thing. Kind of throws you. I'm sorry. Kind of screws you up. So you want to have those three. If something's wrong with one of those, you're going to start to decline and possibly start overtraining. Lack of recovery time. So that is the same thing I just said. If you don't recover, you're going to be overtraining. Poor nutrition. So you're going to need to be making sure you're getting enough protein and carbs to recover, because if you break down those muscles, you're going to need adequate nutrition to recover. And dehydration is really important too. Well, hydration is really important.
There are a few predisposing factors to overtraining as well. So for highly competitive athletes, there's the physical stress of them trying to perform at their best every night, so that way they don't lose their starting job or whatever. There's the physical stress. You mentioned poor diet, dehydration. Always got to make sure you're getting enough energy. Always drinking water or something to hydrate, Gatorade, get your electrolytes in. And then travel is probably a big one, because personally when I travel, I find it very hard to get adequate, good sleep. And then there's psychological stresses, there could be a history of mental health issues, economic, just poor finances, whether it be in school or not making enough time to work because you're training so much, stuff like that. Social stress, and then again the stress of competition.
Okay, and then to diagnose, basically the diagnostic process is ruling out all possible other conditions, because there are, as you see, a list that could cause a lot of those other symptoms that we listed earlier. So it's kind of ruling out a lot of these. So asthma, thyroid disease, adrenal disease, diabetes, iron deficiency with or without anemia, infections, and also malnutrition. So if you look at those, a lot of those symptoms are very similar to the symptoms that we also outlined, but yeah, like I said, the diagnosis is a lack of any other possible diagnosis or explanation for these. And then a nutrition assessment should also be assessed to analyze caloric expenditure. Also, cardiac should probably be assessed, to see the increase in heart rate, that type of stuff.
So the treatment for overtraining syndrome is basically just to rest, and then slowly build yourself back up. And you should slowly build yourself into exercise to start with, but definitely when you're coming back, just slowly build up into that same intensity. And then, like I was talking about before, balancing the overreaching with recovery, so kind of like the graph. If you are stressing yourself, you want to make sure you're having enough time to recover. Cross training, so doing different types of training is very beneficial. Involving a sports psychologist is a good idea, because like we were saying before, this can have a pretty big mental aspect to it, not just physical. And then reevaluation and definition of expectations. So if you do have unrealistic expectations, you need to change those, make them more realistic. And then once again, proper nutrition and hydration are going to be a really big part in the treatment.
And then prevention of it. When you are training, try and like keep a list of what you're doing. Try and track it from day to day, week to week. That way, when you start seeing like symptoms of fatigue, you know to try and rest a little bit. I do know they have heart rate monitors out there. You can also test that, like when you wake up, before you go to bed, like shortly after any kind of training as well. You know, mood questionnaires you can do. Education is probably a big one as well. Educate yourself before jumping into anything. Don't always take the advice of your friends just because they've been doing something. Doesn't mean it's going to work for you. You got to figure out your own niche in it. And then limit the risk, beginning signs and symptoms, and adequate rest.